I'd like to extend a very warm welcome to our guest of honor. May I request all of you to please put your hands together and extend a warm welcome to Dr. Vishal Chauhan, Joint Secretary, Ministry of Health and Family Welfare, Government of India, joining us to address this august gathering. A round of applause, please.
Thank you very much. It's really a matter of great pleasure and privilege to address this forum, as it provides an opportunity not only to reform the trust on health for all, but also to reiterate the importance of health sector in the economic growth of the country and also to explore possible areas of partnership. I'm also thankful to Economic Times and the group for inviting me and inviting all the luminaries who are present here, where we will share, we will discuss, we will interact with each other, and we will be more wiser after this event. And today I have been told to talk about the growing health infrastructure of the country, and I was part of some of the discussion. I listened to the discussion, and one of the issues was raised. We are only talking about only 2% of the population, and what are we doing for the rest of the country? So I am probably from the government side. I am going to answer this question. And many of you must have heard about what Ayushman Bharat. There is a scheme. Earlier there were 2 pillars, now there are 4 pillars. So Ayushman Bharat, it is very important for everybody of us to understand that what Government of India is trying to do in the Ayushman Bharat. Ayushman Bharat scheme was launched in the year 2017 with 2 pillars. One was Ayushman Bharat Health and Wellness Centers, and second was Ayushman Bharat PMJY, Pradhan Mantri Jan Arogya Yojana. The Ayushman Bharat Health and Wellness Centers scheme envisages to set up 1,50,000 health and wellness centers across the country, all over the places. Earlier we used to have health sub-centers where we were catering only for the reproductive and child healthcare services. Now Ayushman Bharat talks about comprehensive primary healthcare, means we talk about non-communicable diseases. We all know that 60% of the people die because of the non-communicable diseases like heart attack, diabetes, and hypertension, etc. So now Ayushman Bharat is addressing this issue, that we address this problem of non-communicable diseases at the village level, at the primary healthcare level. It has an additional community health officer she is a trained nurse. It has now defined that 14 diagnostic services are available. 63 medicines are available at the sub-center. Then there is and also health is not only about the curative part of it, where it's only medical side and treatment side, the wellness, the lifestyle, all these non-communicable diseases are the lifestyle diseases. So people in the villages have that hypertension or diabetes, they don't know. So a healthy lifestyle, what to eat, Fit India movement, these kind of campaigns are also run. Because prevention is also very, very important. The promotive aspect of the health is also very, very important. So that is one pillar by Ayushman Bharat Health and Wellness Center. The second pillar is PMJY, which all of you know about it, is that where if somebody is required an IPD procedure, then government is covering 10 crore families all over the country, about 50 crore people under this scheme, where a person is assured for 5 lakh rupees worth of treatment in a year. So in this also about 18 crore individuals are connected, they are enrolled, about 3 crore procedures have been done since the launch of the scheme. So it is really helping poorest of the country in getting the treatment in some of the finest hospitals of the country. Now 2 more Ayushman Bharat schemes have been launched, and these are very, very important, and they have been launched in the year 2021. One is Ayushman Bharat Health Infrastructure Mission. And in this, what is coming is that when we talk about the shortfall in our health infrastructure, this scheme is going to address this problem. The total size of the scheme is 64,000 crore over a period of 5 years. So what are we having in this? Every district of the country will have a critical care unit. It will be 50 bed or 100 bed. So God forbid if a crisis like COVID's come, then our normal routine hospital services are not get affected. Everybody will remember when the COVID was there, then if a hospital is a COVID hospital, then services for the other diseases got obstructed. We know very well. So there has to be critical care block in every district of the country where infectious disease can be taken care of. Our routine hospital services do not get affected. Every district of the country will have an integrated health lab, so that now for confirmatory test of the cancer, one has to go to the state headquarters or to big cities like Bombay or Chennai or Delhi. So every district headquarters will have an integrated public health lab. Then we'll have a block public health unit. Urban health there is a huge gap in the urban health. So the urban health primary care function, about 11,000 urban health and wellness centers are going to come. Some 17,000 village health and wellness centers are going to come. So it's a big ticket infrastructure reforms are coming under the Ayushman Bharat Health Infrastructure Mission. And then of course some research component is there with the ICMR and all these things. And lastly, I will talk about the fourth pillar of the Ayushman Bharat, that is Ayushman Bharat Digital Health Mission. What Dr. Madan Gopal was saying just now is that every citizen of the country have to have a Abha ID. We call it Abha ID. It's a Ayushman Bharat health account. It's a health ID. We have around 15 portals in our health ministry only. We have one portal related to reproductive child health, one portal for the non-communicable diseases, one portal for the TB, one portal for the blindness control program, and these portals do not talk to each other. So if a pregnant woman is having a TB, the RCS portal doesn't tell that she has a TB, and TB portal doesn't tell that lady is pregnant, is a high risk pregnancy. Accordingly, the action has to be taken. So what this Abha ID is connecting all the portals together. And what happens is that somebody get referred to a higher center. Then how do we know whether he has reached to the higher center, whether he has taken medicine or not? So when he goes to the higher center, through Abha ID he will get a scan, he will get registered at that higher center. That higher center can be in a government hospital also, can be in a private hospital also. So earlier, people used to carry a bag where, a report, one has to carry that, what is the past history of hypertension, diabetes, what is the X-ray report, what is the, ECG reports. Now it's not required. If it is there in the system, the data will lie in the system where it is. But a private or a government hospital will be given a right to access that data. So the patient is the owner of the data. We should never forget that. The patient is the owner of the data, but if he goes in a private hospital or in a public hospital at the district headquarters from the village, he will give his Abha ID, then he will get a OTP, and with the OTP he will authorize the concerned private or a government hospital that you can see my data. So whatever data in the public system I have, what is his blood pressure for the last 6 months, or what is his diabetes for the last 6 months, it will be visible to the private or government hospital. So that is the kind of integration we are having all over the places. Artificial intelligence, there is a lot of talk about the telemedicine, there is a lot of talk about artificial intelligence. 2 months back, MD Tamil Nadu had come to me, MD NHM Tamil Nadu had come to me, sir, I have got 2 lakhs MRI scans with me. Now I have found a AI solution that I will run this MRI scan in my system. I will know that how many people are affected by the TB. That AI will tell you by doing the scanning, that how many are affected by the TB. Similarly, now by the sound of cough, we will come to know we have recorded more than lakhs of cough sound. And people who have TB have a different kind of a cough sound. So by sound of cough, we will get an idea whether the person has a TB or not. Now skin test is coming. So it is a challenge before us that whatever the innovations are taking place in the startup and in the private sector, how we can very quickly validate the technology and include in our national programs and include in our systems. So that's a very good, that's a challenge before us, and we have to do it. So country is moving very fast. India is investing heavily on the Ayushman Bharat 4 pillars. Lot of investment is coming in the health sector. And besides that, let us not forget the two COVID packages given to the various state governments and money was spent was ECRP 1 and ECRP 2. Emergency COVID Response Package 1 and Emergency COVID Response Package 2, where especially in the second package, lot of fund is provided for the infrastructure, lot of ICU beds capacity is generated, lot of oxygen capacity is generated. So lot of investment is coming in the health sector, and that is why if you see our national health accounts of the 14-15, the GDP expenditure on the health was 1.15%. In 17-18 it became 1.35%. National health policy says that it should be 2.5% of the GDP. So that is and it has to be achieved by the year 2025. So that is the target, that more and more investment is coming in the health sector. But it is not that only central government is investing in the health. State governments are also investing in the health. When we announced the emergency COVID response package 2, at that time the response we got from the states, sir, thank you very much, but on our own also we have created a lot of ICU beds capacity. So states are also investing a lot as far as this is concerned. Now obviously the question will arise is that if we are creating so much of infrastructure, who is going to man this infrastructure? So this one area of human resources where government has worked really very hard, invested a lot, is the human resources. In 2018 we have 479 medical colleges in the country. Now we have 562 medical colleges in the 2020, and it is increasing every year. In the last 5-6 years, the UG seats have increased from 67,000 per annum to 84,000 per annum, and PG seats have almost become double, from 31,000 to the 54,000. So lot of undergraduate doctors, lot of PG specialists are coming out. They are getting absorbed in the private sector, they are getting absorbed in the government sector. So lot of investment, lot of human resources is coming in the health sector. Now I will end my talk by saying very important things which Honorable Minister Sir is following very I will say with a lot of efforts and vigor, is that two concepts: heal in India and heal by India. The heal in India is, and it will create a lot of curiosity in the investors who are sitting here, is that India has a lot of potential for quality but affordable treatment as compared to the many foreign countries. The cost of treatment is much less, but quality is equally good. So government is working very hard to facilitate how we can bring more and more patients from other countries and they can come to India for treatment. This will create more jobs, this will create more infrastructure in the health, and it will be a win-win situation for all. Other concept on which government is working very hard is the heal by India. The concept is that Indian doctors, Indian nurses, Indian paramedics are known for their skills, known for their quality all over the world, and they exceedingly do very well whenever they are outside the country. So as so much of manpower is now we are getting produced. So the idea is that we should meet the demand of the country, but we should also we should be a manpower supplier to the world. As a Deputy Director AIMS, I held this post for more than a year. Every second day or every day, file will come for resignation of a nurse. And I says, where are you going? Everybody is getting a fantastic opportunity in Western countries. In a day, 1 or 2 nurses will resign. In a year, 500 nurses will resign. Not that they are getting less package or it was less fruitful job for them. They were very satisfied with the lab, but they are also getting the good opportunity outside, and it is a win-win situation. So lot of nursing colleges are coming, more are required, and they will meet the requirement of the country, and they will meet the requirement of the world. So there is another area where lot of country has a scope where Indian human resources will serve the country and will serve outside the country also. So these are the some of the and telemedicine, I want to tell you, 3 months back, we were doing 1.5 lakhs teleconsultations in a day. And there was a program by the Honorable Minister on 16th of April, where he talked to some of the people all over the country. It was a universal health coverage day. And you will not believe, in 1 month, the teleconsultation increased to 3.5 lakhs per day. So teleconsultation is also increasing. In the recent budget announcement, there is a budget announcement for the recent budget. There was budget announcement for the telemental health. So that is also is coming. So because mental health is also, especially during the COVID time, lot of people face this problem. So lot of things are coming in terms of infrastructure, in terms of technology. Private sector is coming with lot of investment. Government is coming with lot of investment. And India has a mixed pattern of public-private partnership. So we are very, very hopeful that healthcare is going to improve further and further in the country. So I just wanted to say these few things to you. Thank you very much for inviting me for this event. Thanks. I'm grateful to you. Thanks, everyone. Thanks.